Actor Shreyas Talpade underwent an angioplasty after suffering a heart attack. File. As actor Shreyas Talpade underwent an angioplasty after suffering a heart attack, he has become one among the growing number of Indian men who experience a heart event before they turn 50. In fact, the Indian Heart Association says that 50% of all heart attacks in Indian men occur under or at 50 years of age. Most of these incidents happen because of blockages in the arteries or from sudden cardiac arrest, SCA, a condition where the electrical impulses in the heart stop suddenly. And episodes are sudden in nature. Even Talpade was reported to be jovial on sets, had completed some action sequences while shooting a film, and had gone home when he complained of uneasiness and then passed out. What we don't realize is that regardless of the amount of plaque deposited in our arteries, they can cause a problem anytime. Sometimes smaller clots may be non-threatening, but once they are dislodged and tear the arterial wall, blood clotting happens, turning them into a huge blockage in no time. It's like some bushes on the sidewalk which just sit there on a normal day but get uprooted easily in squally weather and stop traffic flow on the roads, says Dr. Muhammad Rehan Saeed, consultant, cardiovascular and thoracic surgery, Manipal Hospital, Bengaluru. Of course, what caused Talpade's heart attack is not known, but there are triggers that people need to be aware of. Dr. Saeed feels genetic predisposition is the principal trigger among Indians. Studies have shown that we are genetically predisposed to developing cardiac problems a decade earlier than our Western counterparts. Cardiac problems in Indian adults develop in the early to mid-40s, and hence they are at a greater risk of experiencing angina or cardiac arrest. Indians are also genetically predisposed to piling up bad cholesterol, low-density lipoprotein or LDL, and triglycerides. LDL builds up plaque and triglycerides contribute to hardening of arteries or thickening of their walls. Of course, all of this gets complicated by comorbidities like diabetes and hypertension. That's because the signs are often non-specific and mimics problems related to acidity, a nerve or a gastric pain, adds Dr. Saeed. A normal ECG, echo and stress test may not be very effective in determining the condition of the artery. A CT coronary angiogram showing low calcium score and less than 30% blockages is an indication of low or minimal risk of coronary artery disease, CAD. That's why heart screening is important. Also, determining your diabetes status is one of the best ways to keep CAD at bay. Those in their 40s and 50s to be on guard and rush to the hospital should they complain of shortness of breath, palpitations and episodes of near or total loss of consciousness, advises Dr. Saeed. Other than diet, moderate exercise and weight management should become mandatory regimes. Limit alcohol and smoking. If you want more informative content like this, please subscribe.